Watch this.
Boise State is just 2 days away from hosting the largest gathering of people in Idaho since the beginning of the COVID pandemic. More than 30,000 fans packed into a stadium. But as healthcare workers struggle to take care of the current sick, what measures are being taken to make sure we don't make it worse? Co-opting catchphrases, what Idaho's health freedom folks are doing again and why they are being called insensitive and inappropriate for their latest attempt. You know, we couldn't bake a cake big enough to fit 135 candles, but we're going to celebrate anyway. Happy birthday, Nampa! Imagine what 3 guys and $200 could do. Well, don't actually, but we'll tell you what they did do.
We asked the fans to abide by the masking rules and do everything possible to keep, our student athletes, our fans, and our community safe. And we're going to continue to work our process. I'm grateful for our health and wellness staff and what they've done and all the experts that have poured into us in trying to help us get to game day. And so from a concern standpoint, I'm not concerned at this point in time. We're going to be at full capacity, and I fully expect to sell out.
That was Jeremiah Dickey, Boise State's athletic director, before Boise State's season opener in Orlando last Thursday. He was talking about this Friday's upcoming home opener on the Blue. And since then, well, a lot has changed. Yesterday, the state implemented crisis standards of care in North Idaho. And while that may be more than 350 miles away, what's happening there will likely affect what's happening here in the Treasure Valley hospitals. And we're told an outright crisis care declaration not that far off elsewhere in the state. As all of this is going on, Boise State fans are getting ready to gather and cheer on the Broncos, that is, in person for the first time in nearly 2 years, at least all packed together like that. Albertson Stadium is expected to be near or at capacity by Friday night, with 37,000 people hopefully in attendance, as they say. As you just heard, no plans to limit that number. And as we hear constant pleas from medical professionals for people to not gather and to get vaccinated, we wanted to know what BSU is doing to align with that and what medical professionals have to say in return. Here's Katya Stepovic.
1 week ago, President of Boise State University, Dr. Marlene Trump, sent out an email to students and staff stating that if on-campus COVID cases continue to rise, activities and events, things like football games, would be delayed or canceled. But today, preparations for the big game are in full force. And a viewer sent us this question yesterday, asking, quote, with COVID numbers increasing to the point hospitals are full, should BSU have no fans in the stands for this week's game? Good question.
The situation that we see in our hospitals, I'm not sure that it's fully appreciated broadly across the community or across the state because the daily activities happening out and about.
Dr. Mark Nasser, president of St. Alphonsus Medical Group, says just like most of the Gem State, Ada and Canyon counties are also struggling to keep up with the volume of patients needing care. And heading into a gathering with over 30,000 people,
I think folks who choose to attend the game in person should be aware that that would be a situation of significant increased risk and exposure, just because of the numbers of people, large numbers of people gathering together in one place.
Boise State University will require all attendees to mask up, but realistically,
the ability to enforce the wearing of masks or keeping distance when you're gathering that many people in a small space would be very difficult.
Because of that, he says community support is needed now more than ever. And if you're thinking about attending Friday's game, really think about your decision.
This is a situation for sure where we should be very thoughtful about the increased risk to ourselves, to our community, to gather in such a way. We're anticipating that a large gathering of hundreds or thousands of people would result in increased cases that would be reaching our healthcare system in the coming days afterwards.
Although a full house is expected at the home game, Dr. Nasser recommends that capacity is limited in large gatherings as the Delta variant continues to swarm the Gem State.
Our teams are exhausted and they are fraying, and they are needing the help and the support of the community to get through. They probably are unable to sustain the level of effort and level of care that they're providing, which is really above and beyond, much longer.
All right, Dr. Nasser brought up a good point about this enforcement of masks. You heard from Boise State late this afternoon. What do they have to say about this?
Yeah, well, unfortunately, they weren't able to address all of our questions because they're busy setting up for the big day. But they did send us a statement, and I'll read that right here. They say Boise State has been proactive, exceeding current local guidelines by requiring facial coverings indoors and in all crowded outdoor gatherings where physical distancing of 6 feet or more cannot be maintained. Now, we hope to maintain a safe atmosphere by masking along with distancing and proper hygiene. So still no word on exactly how that will be enforced, but they're about 90% sold out tickets, so about 4,500 left tickets.
Okay, so yeah, it is almost a packed house, not complete sellout, but still 30,000 people, more than 30,000 people, and that enforcement thing is going to be, well, something we're going to keep an eye on for Friday as well. All right.
And they'll have more for us tomorrow. They did mention that.
All right, we'll stay tuned for that. All right, thank you, Katya. Well, the medical community in North Idaho is dealing with a situation we've never seen in Idaho. 10 hospitals are under that crisis standards of care, doing their best to keep up with an influx of very sick COVID patients. Today, we waded a little deeper into uncharted waters with military medical personnel from the Department of Defense dispatched to North Idaho to help. So we've gone from asking Idahoans to do the right thing to asking the federal government for help because, well, not enough of us have. Joe Paris shares details on what the role of the Department of Defense will be, how long they're expected to stay and help, as well as insight from staff at Kootenai Health on how this is going to help most.
A day after crisis standards of care was implemented in North Idaho, medical personnel from the Department of Defense are on the ground to support hospital staff at Kootenai Health. Major Ian McInnes, a pulmonary and critical care physician, details the 20-member team he is a part of.
We're mostly comprised of nurses. We have several doctors, and then we have a few respiratory therapists as well.
So what will the personnel be doing at Kootenai Health? A major goal is to simply fill gaps in resources.
Provide some much needed offloading of that stress on this local system, hoping to be able to provide a little bit of room to breathe so that the folks who have been here fighting the battle against COVID for the last months and year can have a moment to sort of regain some rest and continue the fight alongside us.
Kootenai Health leaders say in recent weeks, staff have worked long shifts and extra days just to get by. Dr. Robert Scoggins, Chief of Staff for Kootenai Health, says his support couldn't have come at a better time.
Our staff was stretched to the limit of how many patients we could care for as physicians and also nurses. The ICU nurses that they brought are now helping us relieve some of the stress from our ICU nurses and other nurses in the hospital.
Even with the help, the reality remains. The health system in North Idaho is under heavy pressure as healthcare workers treat very sick COVID patients.
The resources that we're bringing in now helps to put a dent in that for sure, but we are still short, and we will still continue to stretch our staff thin or use different team-based models and other means to offer the care that we can for our community.
The Department of Defense mission to Idaho is set to last at least 30 days. There are hopes that the situation will improve by then, but medical leaders are calling on the North Idaho community to do what they can to help keep people out of the hospital with COVID. Things like masking, physical distancing, and vaccinations are extremely encouraged.
I mean, this is a virus. It just doesn't care what you think. What it cares is that it has people to infect, and right now our community is allowing that infection to go. Pretty much wild.
Major McInnes says that the team will do what they can to take on as much as possible while serving their mission, but that doesn't change what North Idaho medical personnel have already been through and continue to go through.
Emotional trauma that the nurses see day after day it wears on you over time. And really, we've been doing this for, like I said, a year and a half, and our unit's been open for over a year, and that hasn't changed.
All right, Joe, I know that some of the counties up there in North Idaho affected by these crisis standards of care have some of the lowest vaccination rates in the state. And some of the questions we're seeing about this has to do with, well, this is obviously because of the vaccine requirements at the hospitals, but as we learned yesterday, that's not the case.
Yeah, Brian, there's no vaccine requirement at Kootenai Health or really up north at all. So for people saying that this entire situation in North Idaho could have been avoided if the hospitals didn't have a vaccine requirement, you're wrong in saying that. That's simply not the case here. When you talk about the vaccine percentages and the inoculation rate up north, Idaho County in North Idaho, and if you look really north of Idaho County up to the border of Canada, the vaccine rates by county varies between 30% all the way up to 53%, being the highest there there, Brian. So really, the highest percentage you're seeing anywhere in North Idaho is only about half the population is vaccinated. That's why the team at Kootenai Health is asking for the community's support. They say that we need you to do whatever you can to keep you and your loved ones out of the hospital with COVID. One thing they continue to point to, though, in North Idaho, Brian, is that there are not the mitigation efforts up there that experts wish there were.
And a lot of those hospitals under this list of 10, the rural hospitals, kind of clinics in some of those cases, and everybody just gets funneled to that Kootenai Health because it's, well, the largest in the area. All right, thank you very much, Joe. Well, first, they came for the masks, to borrow the vernacular of those who have been so opposed to any sort of pandemic protocols. Opposed to limited gatherings, opposed to shutting down businesses temporarily, opposed to wearing face coverings indoors. They've been a vocal group, rallying, protesting, even performing political stunts like burning of masks. Remember the references to essential workers and yellow stars? A nod to Nazi Germany to elicit emotion for their cause. Well, those moments were called inappropriate and insensitive by a lot of people, including the Wasmuth Center for Human Rights in Boise. Well, then they came for the vaccines. And maybe you've seen this floating around social media lately, last few days. A memorial and vigil planned for September 25th for the victims of vaccines being put together by the Idaho Freedom, or our Health Idaho Freedom people. Yes, this is what they said. Victims of vaccines. It says there's one in North Idaho and another one scheduled for 10 a.m. at the Anne Frank Memorial in downtown Boise. And they're even offering to sell you a T-shirt with the phrase, "Stop shooting us," surrounding a picture of a syringe there. Clearly a reference to the Black Lives Matter marches from more than a year ago. Only here's the problem. The Health Freedom Idaho folks didn't bother to ask permission to use the Anne Frank Memorial. And the Wasmuth Center put out this post this morning. Contrary to what you've seen posted, there is no vigil in the Anne Frank Memorial, Human Rights Memorial, on September 25th. The memorial was previously scheduled for another event. And apparently they're planning on hosting some tree fort events that day as well, and they're also scheduled for some regular maintenance of the memorial. So if you're planning on attending this vigil downtown, don't. Besides, according to Dan Prinzing with the Wasmuth Center, to host an event with such a divisive group in a place that is supposed to represent the common good, well, what kind of message would that send?
An exact message that is not the memorial, nor would we ever endorse or condone within the space. Using or co-opting messages from the Holocaust, or in the case of an organization, co-opting from Black Lives Matter, critical movements, and trying to use this as a fundraising opportunity. The memorial is a place where we come together. The memorial is a place where we come for hope, where we bring a community together. To me, that speaks to the very nature and the very heart of what our community is. How do we treat one another? Well, as I say, this is not a space where we come in to create a divisive action. That is both intended to inflame, but also to mock what is very much a reality for those whose family history was the Holocaust, or today, whose family has been impacted by a pandemic.
Dan told us he tried to reach out to Health Freedom Idaho, but his emails bounced back and he couldn't get them to answer his phone calls. We also tried to ask their members a few questions, but our requests also went unanswered. One of them even reposted the vigil announcement by adding they will be in attendance because they, quote, lost someone to the COVID jab, end quote. And since we get this question a lot, we went back to the VAERS website. You know, that's the website where anyone can post any adverse effects of any vaccine, verified or not. And according to VAERS, Idaho has had 16 adverse events caused by COVID vaccines that were posted there. 12 of those 16 were reported as deaths, according to VAERS. And that seems like a big deal. 12 deaths in Idaho? Well, we reached out to Idaho's Department of Health and Welfare because if Idaho had even one death from a COVID vaccine, well, that would be a big deal, and we'd likely hear a lot about it. Well, they told us they are not aware of any credible reports of deaths for Idaho residents directly caused by any of the COVID vaccines. And we learned yesterday from the largest hospital in North Idaho, that's Kootenai Health, one of those 10 now under crisis standards of care because of the overwhelming number of COVID patients, they haven't had any patient admitted because of adverse effects from the vaccine. But they now have 111 COVID patients admitted in their hospital, up from 108 yesterday. And 97% of those are unvaccinated. All right, let's celebrate. Break out the birthday cake for Idaho's third largest city, turning 135 years old today. Yeah, there's an age joke in there somewhere, but we'll get to that. You know what else we're going to get to? The text messages that you send in during the show. So if you haven't connected with us yet, now's the time to do that. Send them to this number, 208-321-5614. Whatever questions and comments you have about today's show, and just make sure to include your name and the hashtag, the 208. We're going to share as many as we can at the end of the show. What do you get someone for their 135th birthday? I don't know. It's never been established because nobody's ever lived that long, so I guess we'll never know. But they are celebrating that milestone in Nampa today. And in lieu of gifts, we're giving everyone a quick history lesson about how the largest city in Canyon County sprung from 3 guys pooling together $200 and a little help from the Homestead Act. As was the way in the Old West, the railroad resolved where cities would spring up. And in the early 1880s, the Oregon Short Line was finally finished in southwestern Idaho. It went from Weiser to Wyoming by way of Caldwell and what would be soon known as Nampa, a piece of property in which 3 men saw potential. James McGee, who lived up the line in Caldwell, got together with Alexander Duffs, a local businessman, and one James Stewart from Portland. And they decided developing another railroad town was a good investment. So in 1885, Duffs filed a claim under the Idaho Homestead Act, and he got 160 acres at $1.25 apiece. On September 8, 1886, McGee and Duffs formed the Nampa Land and Improvement Company, and they filed for incorporation. Those 160 acres were then parceled into lots. However, those lots left little room for vices. Being a religious man, Duffs wouldn't sell to anyone wanting to build a saloon, earning the town the nickname New Jerusalem. Well, that pub prohibition wasn't very well imposed because within 2 years, 3 of the city's 28 businesses were bar rooms. Then, as a sort of dismissive act to Duffs, when the family home was moved 21 years later, a brewery was built in its place. And what about the railroad? Well, at the time, Boise was snubbed by the Short Line, but eventually, the Idaho Central Railway connected the eventual capital city to Nampa, a junction that would turn Nampa into a jumping, upcoming city. Yeah, the city of Nampa began with a down payment of just $200. A quick search, and I found 160 acres in Canyon County today in Melba for $1.3 million. Well, Nampa wasn't technically a city until April 17th of 1891 when they put the government together. And the nickname New Jerusalem, that didn't stick either. They kept Nampa, even though there isn't a definitive explanation of where they got it. Some say it was named after a Shoshone Bannock chief who was called Nampa, which Nam is also the Bannock word for footprint. And those natives that lived in the area, at least that's what they tell us, well, apparently they used to pack their moccasins with sagebrush during cold weather, giving them the impression of big feet. So the origin story of Nampa, the name Nampa, about as elusive as Bigfoot himself. And speaking of birthdays, We are celebrating, yay! We are celebrating the birthday of our intrepid producer, Danny Alsop, pictured there on the left, there with Joe, and in the control room doing what she does every day. We wanted to share this with you as well because it takes an entire team to put this show together day in and day out, and we are proud to do this together as a team. Happy birthday, Danny. All right, those temperatures tell us that we're not quite into fall just yet, but it is coming. Still about 2 weeks away from the official end of summer, but we're already seeing signs of slowly turning into fall, which I know a lot of people, or depresses a lot of people because we're not quite ready there. But after a record-setting heat that we've had this year during the summer, fall might not be a bad deal. How about this? Although it's a smoky sunset, it's still kind of nice out there. Taken by a friend. That's B. Glass who took this photo. She took it Monday night in Idaho City. You might know B because we've introduced you to her here on the 2-8 before with her goats. And they all go on hikes together in the backwoods around Idaho City. You can see taking a picture of them while on their hike. When they do, they always send us some of the most amazing pictures that we like to share with all of you. So you can check out these pictures and several others anytime you wish at the KTVB Idaho Weather Watchers Facebook page. And you can check out all of the, pre-fall foliage out there as well. 8 days into September. Yep, bright green leaves are quickly turning into those crispy red ones. Enjoy the colors while they last. And remember, send us your fall photos. All right, just to let you know, we are going to be off tomorrow, no 208 Thursday, because, well, NFL opening night. You can watch the Pride of Riggins. That's Leighton Vander Esch. Dallas Cowboys taking on Boise State alum John Molchan and the defending Super Bowl champs, that's Tampa Bay. It's starting at 5 o'clock. The pregame show does anyway, right here on Idaho's News Channel 7. But we will be back on Friday, and we do have some pretty incredible stories to share with you. 20 years after the attacks on September 11th. We're going to take a look back, and we're going to talk to some of the people that were closely involved here in the state of Idaho. We're going to do that on Friday. All right, let's talk about what we're talking about today with your comments that you sent in during today's show, like this one from Connie. Brian, if the U.S. Open tennis tournament could require every person who enters to show proof of vaccination, why can't the BSU game do the same thing? Well, way back during the legislative session, Governor Little signed a proclamation, a declaration that there will be no vaccine mandates, as he said, no vaccine passports. Idaho cannot require those to get into public buildings that belong to the state, which Boise State does, so that won't happen in Idaho. Brian, why don't we go forward with expressing that people who refuse to get vaccinated are selfish and non-caring of others? Why are we afraid to openly admit that? A lot of people do. That doesn't mean they can't get served at a hospital. If there was a death from a COVID-19 vaccination, do you really believe the government would give you an honest answer? How many people does it take to keep a secret, Tom?